Hi everyone. Today we have Dr. Shanmugasundar sir from Magna Chennai, and today he will be speaking. He'll be helping us with a couple of information about early puberty. So, hi sir.
Right.
So first, we would like to know what do you mean by early puberty?
See, early puberty or precocious puberty can be multiple types. What we usually say is if it is the girls, and it's different for girls and boys. In girls, if they are having any changes in their secondary sexual character like breast development or hair growth over the pubis area, we call it as early onset of puberty. Anything before 8 years, or if the girl is having a period, attaining the menarche, anything before 9 years, we call it as precocious puberty. There are some subtypes also. Some girls will have only breast development, but there will not be progression. That is called as premature telarchy. And some girls may have only hair growth over the pubis area, but no other progression. We call it as premature puberty or adrenarche. And those are benign things. We usually don't do anything, just keep under follow up. But anything, as I told, secondary sexual character before 8 years, and then there is a progression of the symptoms like breast development, other things, and age, having the menstrual bleeding before 9 years. We need to evaluate for that. Those will be commented because of puberty. Most of the times it will be benign, but sometimes there can be underlying pathological things, so we need to evaluate for that. And in the boys, again, any onset, any symptoms before 9 years, then it is called as precocious puberty. Again, we need to evaluate for that.
Thank you, sir. And how do you diagnose early puberty?
When early puberty is mainly clinical, first we need to clinically see whether there is any onset of symptoms in the girls or boys. And usually they will have growth spurt also. There will be increase in their growth during that time. If any boy or girl is suddenly there is increase in growth at younger age, then again we need to suspect whether there is a growth spurt due to puberty. And plus, if there is any symptoms like this, they need to contact the doctor. At least they have to make sure that that is not abnormal. Sometimes it can be a normal progression of the puberty, but we have to make sure that it's not that abnormal onset of puberty or progression of the puberty. So once the patient comes to us, then we do certain tests like blood investigation. We look for any hormonal changes, and many times, sometimes even problems like thyroid or prolactin hormones also can cause changes in the puberty. Those are easily treatable. There are some conditions where this kind of some treatment can lead to decrease in the progression of the puberty also. So we need to rule out secondary causes, and then we look for bone age. So whether the bone age is advanced, again it denotes the patient is going for precocious puberty. Then we, based on the blood investigations and the bone age, then we decide whether to treat or not to treat.
Thank you, sir. And what is the link between early puberty and height gain?
So again, the most two things are very important. One is the psychological, and the kids should be psychologically ready to face the changes whatever they are going to have with the puberty. One is in the females having menstrual bleeding at young age, and they have to cope up with other things like they have to maintain it properly, and if they are going to school, it is again going to be cumbersome. And that's the psychological part is one. Even in the boys also, the changes in the hormone leads to aggressive things, thinking process, etc. Again, they have to cope up with this. So psychological part one. Second most important is height, because usually the height comes with an expiry date. After a certain period, the kids don't grow. Particularly if they enter into the puberty, they will grow for another 1 or 2 years. So average, we used to say after once they have the menarche, it will be 6 centimeters for girls, plus or minus. So average 6 centimeters. So usually they grow for next 1 or 1.5 years. So that's a very important thing. So once the breast development starts, the duration for the menarche will be average 1.5 to 2 years. Once they have menarche, then the growth will be there will be for another 1 or 2 years max. So it's always better if there's the early onset of puberty, better to evaluate early so that the height also doesn't get compromised, and psychological thing also can be taken care of.
Thank you, sir. And how do we treat early puberty?
Again, as I told, it's most of the times it will be benign. So only just monitoring. We don't treat all the kids. So we make sure that we are not missing anything serious like any other hormonal problems, or sometimes there can be problems in the pituitary which can cause in the early puberty. So we make sure we are not missing anything. Most of the times we just follow up the patient whether there is a progression of the puberty or not. If there is no progression, we just wait and watch. And if there is a fast progression in the puberty, then we intervene with the treatment. There are some normal treatment like tablets or injections are available with which we can halt the progression of puberty. The ultimate aim is that psychologically they should be ready to tackle all those changes, And second thing is they should attend their target height, whatever their height potential. Based on their parents' height, they will having a certain height potential, so they should attain that. So for that, we should discuss with the parents. This kind of treatments are available. With that, these are the outcomes. All those things has to be discussed because it's not only the doctors going to take the call. The parents are also very very important in taking the call because the treatment is going to there for some time. And they have to visit the doctors frequently and take the injections, etc. So it's a mutual discussion between the doctor and the patient should be there and decide about the treatment.
And are there any non-injectable therapy for early puberty?
So usually the injectable therapies are preferred if it is there are two types of again early puberty, that is one is gonadotropin dependent, one is gonadotropin independent. Most common is gonadotropin dependent, which we routinely see in our clinical practice. For that, injectable therapy is the preferred choice. I can understand it's a monthly injection and cost is also slightly high. But now again cheaper formulations or brands are available and people can go for it, and that's the best line of treatment. If the gonadotropin independent precautious puberty, few medications are available, tablets are available that can be used, but again it all depends on the diagnosis, and the discussion between the parents and doctors are very very important to choose which is the appropriate treatment for that kid.
Thank you, sir. And the last question, are there any consequences which parents should be aware for this early puberty?
Yeah, definitely. One is, as I already discussed, psychological thing is very, very important. Height, because many times the people are not aware about this. They will think that the kids are going very fast, they are taller compared to the peers, but ultimately the height will be less where they have early puberty. So that should be taken care. So that is very, very important. Parents should know. And third thing is, rarely they can be subjected for abuse also because of the immaturity of the kids. So that also as the parents have to be kept in mind. But the most important thing is most of the time it is easily diagnosed, and most of the times only monitoring will do. In some patient, if there is a fast progression, the treatment are available with which we can delay the puberty. And long-term consequences of this treatment is also not what to say. There are no major side effects with this treatment, whatever we are giving. So once the treatment stops, then the people will start getting their progression of the puberty as usual within 3 to 6 months, and they will have their periods. And the long term also there are not much consequences. Their fertility part, everything is not affected. It's a very safe treatment.
Thank you, Shanmugasundar, for providing the highlights. I think this will be very useful for the parents in the coming days, and they will help their children to get diagnosed as early as possible. Thank you again for sharing this. Thank you.
Magna, we care, we cure. Magna, Centers for Obesity, Diabetes and Endocrinology. Best thyroid doctor in Chennai. 9/12, 18th Avenue, Ashok Nagar, Chennai 83. Contact 9380 199 199.